So I think that's a screen where you're going to be, oh, he's waiting, so you just go ahead and that. It's recording. Can you shut off the recording for a moment? Or your laptop. He's still muted. We're ready to go, Kelly, at 6 o'clock.
I know.
Just a couple more seconds. He's muted. Just trying to make sure.
Hello,
Yeah, he's unmuted now.
Yeah, but we still can't hear him.
you can't hear me?
This thing has volume.
Oh, great.
Can you try now?
Hello?
There we go.
Okay.
We got you. All right, we're gonna start the
All right.
meeting.
Okay.
You're all set there.
Okay, it's close enough, 6 o'clock, we'll get started. Welcome, everybody. Big group here tonight. First item on the agenda is to consider approving the minutes from the November 9th meeting.
I move that we approve.
Second, all those in favor? Do you want to go to item 4, Ellen?
No, we can go right with Craig if he's ready to proceed.
Okay.
If the council wants you to spin your seats around to watch him or move back up here and.
So you'll go on to the audit and Ellen will introduce thing for us here.
We have Craig from our audit company. Hi, Craig, you're muted again.
Hello, how are you?
And we're just going to turn the floor over to you, Craig, if you want to take it away.
Sure. I just want to open it up and say how well the audit went this year. We did not encounter hardly any issues on the audit side. I did have a couple of recommendations, minor recommendations, but no findings. So you got a clean opinion, and so it was a very good year, both financially for you as well as on your controls and procedures that you have in place. So some of the bugs got ironed out that we were dealing with last year that Kelly had to deal with, and so that was great improvements. So I'll start by, I assume you all have the audit report in front of you. Yeah, so I typically go over certain pages on the audit report, not in great detail, but just some highlights. So I usually start with page 14 and 15. So page 14, I just want to point out that this is a report that is presenting the town more like on a business entity type. So it brings on the fixed assets as well as debt associated with the purchase of the assets as well, and other debt that you have that may not have purchased assets. So this presents your overall fund balance, bring on all that activity. So it's basically full accrual basis. So if you look at the bottom, your total net position, you're at $13 million. That seems pretty high, but if you look at the net investment in capital assets amount, that's 7.8 million of that. So that is what is contained in the fixed assets net of debt. So not truly your overall fund balance, but it's a good way for banks to look at your overall financials and see what your net equity is. Page 15 is just a different presentation of rolling up all your funds into one statement in a different format. So it shows your expenditures trying to match up to your revenues that may be associated with those expenditures to arrive at your overall net position that I mentioned in the previous page, the 13 million. So that's all I need to mention on those statements. Page 16. This is the breakdown of your funds by sort of like this is your balance sheet side of things. So coming down to your overall fund balances in each individual fund. So this year you have your overall general fund, your operating budget fund. You come down to your unassigned fund balance, which is at 2.7 million at the end of June. And your overall total fund balance is of 4.7, which has your committed balances of 1.6 and some other assigned balances of $362,000. So overall, pretty healthy position and well within your requirements of maintaining your fund balances at certain levels. Your special revenue fund is new this year. That has a $667,000. That is just your federal grant that came in, the ARPA fund, waiting to be spent in this fiscal year. And then your capital projects fund, which is the remaining balance of your fire station project. So flipping to page 18. Here's your funds broken down by revenues and expenditures to arrive at those fund balances. So you can see in each fund how you got to the overall fund balances. And I won't go over this one too much because I'm going to go over your budget versus actual schedule further on. Page 20 is your sewer fund. So just briefly go over that. Your sewer fund ended up with a net position of 5.8 million. Again, the sewer fund is presented on like a business type. So part of that fund balance is wrapped up in assets and net of debt. So you have 5.5 million tied up in assets with only 259,000 of unrestricted funds in the sewer. And then on page 21, showing your profit and loss for the sewer fund. This typically has a loss in this fund, but it's because of depreciation. So even though it's showing $125,000 negative profit, 181,000 of that is depreciation expense. And new this year is recording 60,000 of interest payable. So we brought on your accrued interest at the end of the year. So that changed your fund balance, reduced it by 60,000 to properly reflect the accrued interest at the year end. So, are there any questions so far? I know I'm going fast, but. If not, so I'm going to skip through. So page 25 all the way through page 41 are your footnotes, and that's what presents more detail of the numbers on the previous statement. It gives a better idea, a better breakdown of many of the items that are contained in your balance sheet. So it's a good idea to kind of look through those. And then on page 43, just the presentation of the budget versus actual schedule after all audit adjustments have been made. So this typically differs from what you might have been presented after June 30 earlier on in the year. So if you look at your budgeted column, your overall revenues budgeted were 12,956,000. That's in that third column. You took in 13,356,000, but and so there you had a $400,000 positive fund balance for the year. Most of that was excise taxes and additional state revenue sharing funds that came in. On the expenditure side, the final budget was $13,793,000. You only spent $13,041,000. So again, another positive budget variance, $752,000. So the overall net positive to your fund balance was 1.1 million. You anticipated, though, to take out funds from your fund balance to cover any shortfalls. However, you did not need to use any of that. So that's brought back into your fund balances in the end. So therefore, your overall fund balance has increased by 305,000 last year to come to that 4.7 million that we saw earlier on at the pages. So overall, good year, both on our audit side as well as on the financial side. So the only things I had, there's a separate letter as I came up with two different matters that I brought up. These are just things that required some adjustments and changed some numbers from what you would have seen in your financials. So the one was the reserve fund balance reconciliation. The reserves were not at the accurate numbers at year end. Some adjustments had been reflected and then reversed due to some trio issues. So the only thing I recommend is just taking a look at those reserve balances throughout the year to ensure that they're recording what was properly authorized or needed to be at any given point in time during the year. So, and just on the cash reconciliations, much improvement over last year. Last year, as you recall, we had a finding over the reconciliations not being done properly or not being caught up. Definitely done properly and caught up this year. We noticed that the oversight, which we like to see some segregation of duties in this area so that someone is taking a look at the reconciliations. We noticed that wasn't done timely. It was just done after the fact later on, but I'm sure that was just a prop because of the process during last year to catch up on those.
Ended up doing the whole year in June and then she.
Yeah. Right. So yes. Kelly is extremely helpful during the audit process, providing documents fairly quickly. So it made for an easier audit for sure. So.
Any more questions for Craig? Well, thank you very much.
You're welcome.
And
Thank you.
yep, you'll be hearing from me.
Okay.
Have
Thank
a happy Thanksgiving.
Thanks,
you. You
Greg.
too. Okay. Thank you all.
Bye-bye.
Thank you.
He's got to finish himself out.
Okay.
We'll be back.
Okay.
Yeah, you can probably shut that right off.
As you all heard, our auditor is glad and pleased with the way our finances are kept track of by Kelly. So that's great. Item 3, you want to introduce this, Ella?
Yes, I have Bill McKenna and Tim Beal. And Bill's are here to do a presentation. Sure. And yes, we have Chris Mitchell as well. Hi, Chris. Turn the floor over to you, Joe.
Thank you.
Well, thank you for having us again. My name is Tim Beals. I'm the Executive Director with Delta. Bill McKenna, Community Relations, and Chris Mitchell is our Operations Director for the company. It's probably no surprise that we're at a point where we need to ask our communities to help us financially with the operations. I won't read this entire presentation to you, but I'll cover a few of the high points. One, just so everybody knows, Delta is a not-for-profit corporation. We're 501c3, formed in 1972. I'm pretty sure, as far as I can go back in our records, that Oakland was one of the original towns that we served from that time frame. So been serving Oakland about 50 years. So that's our board of directors. As a nonprofit, we have a board of directors. It's made up of representatives from Maine General, from Inland Hospital, and from the community. One of the questions we've had from the towns that we've met with, and we've met with 12 so far out of the 14, is a question about representation going forward. Is there an opportunity for people to participate in some fashion? And I'll be bringing that to the board, which meets next week. I'm confident they'll address that in some way. I just don't have an answer for you yet. There's a table in here. Well, before I get to that, just in terms of our services, we're talking about 911 tonight, emergency services, but Delta really is a full service provider. Not only 911 calls, but we do interfacility transports, which are hospital to hospital, hospital nursing home, home to hospital, things like that. And that'll in a minute will become important. We also provide a significant amount of education to the community, to our first responders. We just developed a training center. Took to find time to do it over the course of the pandemic, but we got approval from the state, so we're able to teach basic licensure EMT courses and emergency medical responder courses. We don't do advanced education. That's more often conducted at the community college level, not so much in the training centers. That's been important because one of the challenges we've been facing is a staffing shortage, and having that training center has allowed us to essentially grow our own in some cases. So it's been beneficial. There is a table of the 14 towns and the populations that we serve. The data we took from the Maine Municipal Directory, so it may not exactly match your population census. Certainly prefer that. Delta has two base locations, one here in Waterville, at 29 Chase across from the old Seton Hospital. The other station is down in Augusta on 10 Coney Road. We did have a base at the hospital in Augusta, but we closed that. Basically, it wasn't, trying to find a polite word, it wasn't good accommodations for the crews. It was more or less a garage. Consolidated down those folks over at Coney Road. And it saved us some money in rent. One of the things that sets us apart from other ambulance services in the state is our focus on clinical quality. So Delta does not provide the rescue services that you might think of, like extrication, high and low angle, water rescue. Those are predominantly carried out by fire departments that we work with and the first responders. So our true focus is on the patient, and we put a lot of emphasis on that. Our quality markers are stringent, and our staff last year hit the 95.54% of accuracy in those clinical markers, which is really pretty astounding for EMS. We also have a dedicated medical director. Dr. Steve Diaz, he's the Chief Medical Officer at Maine General, has been our medical director for about 20 years. Very much involved, and actually reviews every 12 lead that our staff does. Every 12 lead EKG, he actually takes a look at it. our two quality managers, coordinator and manager, look at almost every run as it is for accuracy. Compliance program is in place, which is required for Medicare. And the other thing that we do have is we do our own billing. So we manage our own revenue cycle. As we've gone through this process of looking at our finances and finding ways that we can decrease our costs, we did look at outsourcing our billing, and we actually found that it's less expensive and more accurate to keep it in-house. And that's important so that when we do bill, the claim goes out, it's clean, meaning it's accurate. Insurance companies, if they can find a way not to pay a bill, they'll find a way. And so the more accuracy we have on our end, the better. But it also allows us to work with our patients who have a hardship and they can't pay, rather than send them, to collections. We can set up payment plans. We can work with them. We can take a hardship letter and work with them in that fashion. Not to say that some patients in the end don't end up with collections, because they do. But we try very hard not to have that happen. One of the things that we're proud of in working with our partners in the first responders is that over a period from 2015 to 2020, which is the most recent data for the CARES and cardiac arrest data, is we had 41 people survive a cardiac arrest, walk out of the hospital with absolutely no deficits whatsoever. And for a rural system that covers 500 square miles and often has long response times to get to the far reaches of our area, that's pretty remarkable to have 41 people survive a cardiac arrest with no deficits. So we're proud of that. There's some tables in here that show the call volume for the town of Oakland. And our response time in 2021, we had 749 responses for the town of Oakland, and our response time was just about 6.5 minutes, if we round up. In terms of no transports versus transports, and that will become important in a minute. Oakland is pretty much on par with every other community within 1% or 2. So it usually is about 75-25, 75% transports of that 749, about 25% we don't transport, whether we're canceled en route, the patient refuses. There are times we don't transport. So when you see the number of responses, it doesn't necessarily mean that every patient is transported. The significant piece about that is we can only bill when we transport patient. So those times that we don't transport, there's no revenue generated for that response. A couple of a trivia page here just to show you the days for 2021 that had the highest volume of calls. And it looks like Monday and Wednesday seem to be the days in Oakland we're out here more frequently. And then in terms of the hours of the day, probably 9 o'clock or so until just about 6 o'clock. Peak call times for the town of Oakland. And then there's a table that does show you over the last from 2018 till now. Those are the calls that we came out to Oakland for, or responses really from 609 in 2018 to 749 last year. Will probably be around that for this year. Year-to-date data was at 10-1. But if you look at the number transported, so total calls, and then you see the number transported, you can see that we don't, like I was making, but we don't transport every patient. And that has an effect. We participate in terms of funding sources. We participate with all the insurance companies, the third parties like Aetna, Anthem, Aetna, Anthem, United Healthcare, Medicare, Maincare. We're contracted or participating with all of them. The challenge with that is the EMS industry as a whole is not a strong lobby, and we have a hard time pushing for increases. I can tell you, I've been to Washington, I've talked to our congressional delegation over the 20 years that I've been executive director. And we get a lot of platitudes, we're doing a great job, but they haven't moved the needle in terms of what they pay us. The state, we've had more success at the state level. The state has finally agreed and has for a couple of years now, paying us at the same level as Medicare. So Medicare pays the same level as Medicare. And we were successful not too long ago, about 18 months ago, in working, came up during the surprise billing legislation, but to have the third parties pay 200% of the Medicare rate for emergency responses. It's still below what it actually costs us to do business, unfortunately. And I can tell you, we're still negotiating with the third parties to get them to pay that 200%, even though it's in statute. They have found reasons not to do it. And again, part of it falls back to that we're just not a strong lobby. I mentioned that we only bill when we transport, and that's a Medicare rule, so everybody follows the Medicare guidelines. There's 8 total base rates, 2 of them though are for air transfer. So there's 6 base rates we bill from between basic life support and advanced life support. And again, we can only bill for mileage when the patient is on board. So the mileage responding to the scene or going back and forth from the hospital isn't reimbursed. We have been better than most at managing our costs. There's a statistic in here. On a national level, from 2017 to 2020, ambulance costs went up 56% across the country. And Medicare rates went up 5% during the same time. I can tell you our Medicare rate didn't go up 5% over those years. It probably went up 1%, and then they take 0.5% away. Only this year, we're coming for 23 to see that Medicare is actually going to go up 8.7%. I would guess in 24 they'll take half of that away. That just seems to be what happens. Our cost over that same period went up 10%. So we do manage ourselves well. What has really prompted us to have to go to the towns has been the effects of the pandemic and the low call volume. The fact that we've lost 2 communities to municipal services that started up that have cut away at the call volume. And so our business model is fee for service. So our only revenue has come from patient charges. It has sustained us over the years, but it is not a sustainable model any longer. Over the course of the pandemic, people leaving the industry, the fact that the schools didn't produce anybody for the EMS industry, or the fact that people just don't want to go into EMS, period. It's been a challenge for us, for every service, for every municipal service. I think Chief Groder and I sat maybe a month or 2 ago now and just counted up between, southern Kennebec County, north, and we came up with at least 50 openings amongst the services. So there's just not enough people coming out for EMS. So we ended up in a bidding war for wages, and everybody would start ticking their wages up. We in order to keep pace, we had to do the same. In order to retain the staff that we had, we did lose some staff. The city of Waterville, we lost others to other municipalities. The drawing factor there is the retirement, mainstay retirement for the 25 years. We have a 401k with a match, but it's not the same as a 25-year pension. So that certainly is a draw for someone to go to a municipality. If you look at how other agencies are managing their shortfalls, they too are relying on a per capita fee to the communities. There's a table here showing you that the city of Augusta charges a per capita fee. They also charge bad debt. Palermo, which was one of our communities up until last summer, they joined Liberty Ambulance, which is just next door to them. They're assessed $43 per capita. Jefferson was approached by Waldeboro EMS they needed, Waldeboro asked for $100,000 in order to stay in business, which translates to about 40. Medcare charges 45, they're in the Rumford area, and then Gardner has a similar per capita bad debt fee. The difference between us asking $15 per capita and these $40 rates is that interfacility piece. And that we're able, because our units don't sit still for the most part, we're able to use the revenue from the interfacility side to help subsidize the 911 side, if you will. If we did not have the interfacility transport business, our rates we would be looking at $40 per capita as well. There's a shortfall. The Maine Ambulance Association identified when they presented, there's a Blue Ribbon Commission, it's just wrapping up now. It was focused on EMS and looking at the industry and the challenges in the state of Maine. The Maine Ambulance Association made a presentation to that commission that identified a gap between what insurances are paying and what it costs to run a service at a break-even point. And that gap is $325 per call. They made a proposal, and the Blue Ribbon Commission endorsed it. I don't know how it will pan out forward for something on the order of $70 million a year for 5 years, just to essentially bail out services, bring them back up to a break-even point. And there's money. I don't know how the money is distributed. I know there are some for transporting services, some for non-transporting, and then some for the office of EMS. Specific breakdowns. I don't know how much length that will have at the legislature when it hits the appropriations table, if it even makes it that far. So it was the Blue Ribbons Commission, though, it did recommend that get moved forward. So it's the cost of readiness that really is the challenge, right? So you have to have a certain number of trucks to balance the 911s and the facility work throughout the region. It doesn't make sense for every community to have their own ambulance. It's not cost effective. It's cost prohibitive, actually, to have all the infrastructure that we've developed over the years to have to be replicated in every town. You're on the order of, just with our entry level wages, $500,000 a year just in salaries for one ambulance. And that doesn't include benefits and training and those kinds of things. So it's an expensive endeavor. The things that we've done, I say we've right-sized our staff, so we've lost call volume. We certainly have we've reduced the number of trucks we have on the road. We're not staffing nearly where we did, years before the pandemic. That's helped lower our costs in terms of payroll. It's keeping our staff with enough call volume to stay experienced. We have developed a response plan that allows us to use lower licensed personnel when it's appropriate for 911 calls. That's proved to be very effective using the determinant codes from the emergency medical dispatchers. We found it to be accurate in terms of their triaging the call and then responding lower license ambulance when it's appropriate. There's always a paramedic available to respond if need be, and we still staff paramedic ambulances. Going forward, the model will be using that response plan during the daytime hours and then paramedic trucks at night. So it's still an efficient way to operate and maintain costs. And then working with the hospitals to try to just manage the number of discharges and when they discharge so that we're not stressing the system where every ambulance in the area is being asked to do or complete their readiness to move patients between hospitals. That's an ongoing discussion. We're making some headway, I would say. So what it boils down to is we're asking the 14 communities that we serve for $15 per capita. So case of Oakland, it's about $95,000 approximately that we would need to continue providing service. My page is not updated. I believe I updated yours, so that it would basically coincide with your fiscal year. We work off a calendar year, but we understand a lot of municipalities do not, so it would tie in with your fiscal year. Some of the questions that we've had from other communities is, is there an option for a multi-year contract rather than a one-year contract? Would there be increases from year to year? And I think I would be kidding you if I said there wouldn't be some kind of an increase each subsequent year. And I don't know what those would be. The board didn't consider that yet, so they've got some work to do when we meet next week. And then in terms of how it will be paid, some communities have opted to say that they would pay it all up front when their fiscal year started. Others prefer a quarterly approach. I think we would work with the town however they wanted to arrange that. What our commitment is that we have 911 ambulances available for you, that we continue to provide education for your first responders and the fire department, that we wouldn't be charging if Chief Coughlin calls us out to stand by at a fire scene. You're going to have an ambulance there. It's not going to cost the town anything additional to have that happen. If there's special events in town you want an ambulance at, we'll gladly bring an ambulance out and have them there if that's what you'd like. So, and again, we replenish soft goods, oxygen supplies, and things like that we replace on a one-for-one basis that we've been doing for years. And we would continue doing that. And again, just going back to the regional approach, it really, we're hoping that all 14 towns stay with us. And I call it a region, although there's no formal structure to that region, other than the towns using us as their primary ambulance. But it does, staying in that region allows us to spread the costs over many towns as opposed to one town. And again, you're not having to duplicate the infrastructure that we have in place. I think that's important for towns to recognize that, to try to develop their own service. I think a lot of towns look at it as simple as having an ambulance and staff, and it's not that simple. It's fairly complicated to run an ambulance service. So I'm happy to take questions.
I have a question. So if 14 towns, if a couple back out, would our rate go up to decrease?
That's a very good question, and I skipped over that one. I don't have an answer for you. I think we would probably adjust staffing and try to hold the line. But it would mean that we wouldn't have as many trucks available. That's one angle, that's one approach. I really don't, didn't want to be here in the first place asking towns for money. And I certainly wouldn't want to come back in 2 months and have to ask you for more. So I'm going to do my darndest to hold the line.
I would assume if we signed a contract for $15, then that's good for the year. You're not going to come back halfway through the year and say, that's going to change.
I would agree with you.
And you say it says effective 2023, but you would start on our fiscal year, which is July. This is basically brought about by the neighboring towns of ours that decided to put on their own ambulance service, because Delta's been, what'd you say, 50 years?
50 years, yeah.
And as far as I know, it's been a very good service for us over those years. So, maybe the chief can address that.
Yes, we have a good working relationship with Delta, provide good service for us. I'd like to see that continue. We wish it could continue under the same terms we've been operating on for 50 years.
We do too.
But so they skimmed off the gravy off the top, and you're left with the smaller towns, right?
It has had an effect, yes.
So Tim, one of the conversations you and I had, it looked like you lost 3,700 calls between those two towns.
Yeah, that's a lot. That's a lot of call volume. That's a lot of
When do you anticipate having these contracts ready for the towns?
We have some towns that have a January 1st fiscal year, so we'll have them on a specific date.
So as you probably know, a lot of these contracts, the service fees, they follow the cost of living increase, the COLA. Is that something you're anticipating, or you gonna have something more drastic?
I don't have a specific answer for that. That is one consideration.
So this first contract wouldn't have anything in there for verbiage that would address that.
I'm hoping it will. I mean, the board meets next week, so like I said, they've got a lot to process at their meeting.
Don? These are just background questions.
Sure.
How many towns were with Delta, not necessarily at the beginning, but in the past?
Started with 9, right here in the Oakland, Belgrade Lakes area, Waterville, Winslow, Fairfield, City of Bassett. At one point, I think we had 18 towns. that
And
were-
who do we no longer, who do you know? longer?
Yeah, so Jefferson left for just geographic reasons. That was a long run. Palermo left over the summer and went with Liberty. There was a relationship between the fire departments and they chose to go with Liberty Ambulance, which is literally next door, with a shorter response time, but they're faced with the same staffing shortages. Then Waterville and Winslow left. That's it. That puts us in.
I guess the most pessimistic part, and I guess if you could start out with a little scenario, what does it cost to transport a patient who has an accident, say in Belgrade? What do they bill? How much is you don't have to give the exact numbers, but with a guesstimate of, does it cost $350 for them to get that for their accident to the hospital? You submit that to the insurance, you get $250.
We get about, well, I'll tell you. I can give you an example for Oakland. That's helpful. So the average patient charge in Oakland for 2021 was just shy of $1,500.
Right, $350 didn't make it, did it? That I used.
The actual payment was $579. So it's a significant difference between what we bill and what we actually receive. With Medicare and Main Care, you can't balance bill. You get whatever the contract, whatever the fee schedule is what they pay. Medicare, they establish a fee, then they give you 80% of it, and you have to go to the patient for the other 20%. With third parties, if you participate and you have a contract with them, you're under the same sort of billing scenario. You can't balance bill. So it's depending upon where you're at, the mileage plays a factor. If you're farther from the hospital, because we do bill for mileage when the patient's on board, so the bills do vary, but essentially it's on average a 50% off.
Is that $1,500 pretty consistent with the state of Maine?
That's a good question. I know there are services charging more than we do. I'd say we're probably in the middle.
And I guess my initial thought, the pessimistic part of it is, and just as a patient, we all see it when we go to the doctor and they order x-rays and the x-rays are billed out at $500 and they'll allow $67 through Medicare. And then the insurance company says, we're not paying any of it. So the hospital has to eat the rest of it. So the hospitals, the doctor's offices locally, they're all scrambling because they're not getting enough reimbursement. So the pessimistic part is, what's going to happen next year when costs go up, but Medicare reimbursement, Medicaid reimbursement doesn't? You've already alluded to that the second year of the contract contract's going to be different. How are these doctor offices going to survive if when you run a business, you're getting less money this year than last year, but their costs are going up. So I guess that's the bigger worry than how we handle this, is what's going to happen in the near future.
You know, all I can say is that we manage our costs the best we can. We're not an extravagant organization by any stretch. And, make the adjustments we have to. I mean, we're having discussions with the hospital as well for, I guess I would say a service fee as well. But I don't know, it isn't up, this is the last business, and no one should start an EMS service or a healthcare business.
How do the response payments versus the emergency services compare? I assume the hospital probably have a contract of some sort, and they pay you so much per regardless.
So you mean like the inter-facility transport versus, yeah, so inter-facility would still bill the insurance, would still bill a patient's insurance. There's challenges on that side for billing in terms of compliance. Medical necessity is the biggest one. The patient, there's a lot of factors to certify that a patient actually needs the ambulance. So that's a challenge. Some insurance companies require prior authorizations before you move them, or you get so many days to get that prior auth before you don't process payment. The 911 side is a little bit easier, but we've still had calls rejected. When you're reading a run report and you have a patient with chest pain and you've done everything from 12-week to medication, to advanced airway, and somebody comes back and says that it wasn't medically necessary. So then you have to go appeal, prove your case. We usually win, but that takes time. Motor vehicle accidents, you could be 2 or 3 years before you get payment on a motor vehicle accident by the time they settle everything out. So but in terms of reimbursement, it's, both sides pay. There's a few more wrinkles on the inter-facility side that we have to comply with, which is why it's important, in-house billing, we can catch those and make sure those things are taken care of. There's essentially 6 base rates that you bill from. Medicare has established, and every insurance company follows them. They all pay a little bit different, in terms of how much they pay, but they all follow those same billing codes that Medicare establishes. There's no fees for supplies or anything like that. It's a simple base rate and a low mileage charge.
What is left for the patient to pay usually?
Well, it depends on their insurance. So, with the high deductible plans that we have nowadays, often they're getting the whole bill. If they haven't met their deductible yet. It's, again, one of the challenges for EMS, whether it's us or anybody else. Our bills usually get there first. They may have been admitted to the hospital. They may have a very extensive hospital stay and an expensive stay, but that bill usually doesn't get there for quite some time. So their deductible hasn't been met. That's a real factor in EMS billing. Having to go to the patient, either set up a payment plan or offer them some sort of discount or something just to get some payment at, or they end up in collections eventually. It's not a lot of leverage.
What part of the reason that brings you here is the fact that Waterville and Winslow left? If they hadn't have left, would you have struggled along somehow?
I think we'd be here, but it wouldn't be $15. I think.
You've done the math for the $15 for all of your 14 towns, and the answer is
About 660,000.
660.
Roughly.
If Waterville and Winslow were still here, let me ask that differently. If they hadn't left, what would your revenue have been for those 2 towns, you know? Would it have been 200,000, 400,000,
More like
more?
a million,
I'm sorry,
1 million.
so you lost a million. Have you thought about what you would do if one of those 14 towns, and maybe only one of those 14 towns decides they don't want to play, they're not paying? At some point, the ambulance stops going,
Correct.
and you have a date for that? Is it
It would be
the middle of 2023?
whenever, that's a good question. I hadn't thought of it. I've been asked that question, but I haven't been asked the point of when would it stop. That's,
I'm constantly amazed of the particularly healthcare providers and hospitals and doctors and ambulance services who all claim they're losing money. They make it up in volume somehow. The hospital's losing their shirts, but they're all still there. They're all still paying their CEOs and doctors and nurses. And I'm glad they are. Kind of puts everybody in a box, including you. And I don't, certainly it's a reasonable expectation that salaries will continue to increase and that it's harder and harder to get emergency service providers. Trucks cost more and diesel costs more. But as soon as a couple of towns peel away, and it will be worse if a couple of other towns somewhere, a couple of the other larger towns peel off and decide they can, and then you're going to be left with 10 towns who all need to pay instead of 15. But I'm rambling, and I don't see the solution.
David?
So just a realistic look at this. If these towns start to consider dropping away, they really don't have anywhere to go. That being completely honest, I mean, I'm not saying you're the only show in the area, but to provide what they're providing, the rate which they're charging is very responsible. You can't go from Sydney and say, well, we'll just go with Augusta, because Augusta's not looking for work. Waterville's not looking for work, and who's that leave in the area? Nobody. That's a realistic view of it.
You know, Delta was a true definition of regionalization. They worked for 50 years. And it would be shameful to see you guys go away. No question about it. Been around since I've been a kid. So
it's 50 years is a long time. Sir.
So I have a question. So just say our ballpark figure is $100,000 a year. Just for easy math. You only show up to 70% of the calls. Are we gonna get a discount of $30,000? Just asking.
Yeah, no.
But we have to go back and talk to our constituents and say, hey, do we want to do this? Right? So that's, and then we can't guarantee your service every time there's a call because you guys are busy. Because you are the only game in town, basically, because, and I'm not knocking, you guys have done a great job. I'm just thinking, how are we gonna put this out to the constituents and tell them, a bird in the hand is better than two in the bush. Because really, that's what it is, Do I agree with the $15 amount? No, I don't. I'm sorry, I don't. I've been here 32 years, never had to use you once, but and now we're gonna have to tell every taxpayer in town, you're paying $15 whether you use it or not, but then they're gonna tax your insurance. We're gonna go after the insurance company too. So how many calls did you have in Oakland last year or the year before?
It's about 749
749.
with the responses, correct. We transported less.
If I did my math right, that 749 times $1,500 comes up to $1,123,500. Wrong?
Wrong,
Okay.
because those 749 responses were not billed.
Oh,
So of that 749, take 25% off.
Okay.
And then,
because that, but you told us the average call to Oakland, the average
was
Was-
billed, was 1,500.
was $1,500.
Right.
So every time you get called out the door, it's $450, correct? Just like a wrecker or something like that. If a wrecker Timmy Trailer leaves his office, immediate, it's $125 just to start the truck. He hasn't got there yet.
Right.
And then he charges $20 a mile or whatever you guys charge.
But of that 1,500, we're reimbursed about half, less than half. About a third.
About a third, yeah.
Yeah.
Insurance company's great. Thank you.
Dave, you have your own ambulance service for your fire department in Augusta, right?
Right.
How much do you figure that part of your budget, and have you figured out on how much per capita that is in your budget or anything?
We don't break ours down. We have a per capita fee that we charge other communities that we service, and it's slightly more than what theirs is, plus uncollectibles.
So you have done some calculations that say this is approximately what it costs us. to
And we're lower than the average.
Yes.
Can you explain what the uncollectibles are?
So if somebody's, say we go to another community, they get their insurance bill, they pay 75% of it, and 25% remains, the community is responsible for that.
So is Delta going after uncollectibles?
Not from the towns.
Not the towns.
That's why with our billing department, we're confident in getting that money, as much of it as we can, more so than an outsourcing to an agency that's working for 25 services. You know, the attention to detail is greater in-house.
I think we're gonna realize just how good we had it.
Well, I think,
Just one last thing, on a personal note, I have a relative who I am responsible for. And she had an accident and lived in the town of Freeport, still lives in the town of Freeport. And the town's rescue vehicle came to see if she was okay on a 911 call. And then a separate ambulance company came and trucked her to the hospital at Penn Bay Medical or something. And the ambulance company got paid, and I'm currently in a negotiation with the town of Freeport, who billed her for the rescue. Oh, does Oakland bill anybody for,
We don't do any billing.
you don't do any billing for rescue calls? A lot of, do most towns?
I don't believe so.
Is Freeport an outlier maybe?
That confuses me, boss, because Freeport has its own supporting ambulance.
But they may well, anyway,
What
I'm
if it
getting off.
broke down?
But the answer is the fire department doesn't bill anybody for the 911 call.
Correct. I don't, as a first response agency, such as ourselves, they're not billing. Fire departments are not billing for those services. That's your tax dollars, that's your.
I mean, you could make the case that the person who needs the 911 call and needs a EMS to show up at their house because they've been involved in an accident or at the car accident, that they might shoulder some of that responsibility and relieve the other 6,000 people in town from their assessment for the ambulance service. No?
There are some first response towns or agencies that are billing for car accidents, but not specifically for patient care or an extrication, fluids cleanup, situations like that. But it would only be the ambulance service that would bill for patient care that I'm aware of.
Thank you.
so we need a proposal for when we go to budget meetings this window, right? And
Wait, I
for
think,
us to discuss and compare, and
wait, I don't think we need to vote on anything
no,
tonight.
but we need a proposal in time for budget discussions this window.
We're gonna be starting that bill fairly quick. I mean, we've already started the process now. And so the quicker you can get something to us, easier it's gonna be, even though we're not gonna be voting it on anything until July 1st or for July 1st. We're gonna be building our budget this
Next month.
one by next month.
And voted on it in May, so you would, if it passed in May, then you would have insight.
And I may bring you in one more time for a presentation with Budget Advisory Committee. if you're acceptable.
We also get some comparisons, maybe the chief to do some comparisons of surrounding towns of costs and things that we can look at for comparisons. So is that available, something you can,
Comparisons for as we function or comparisons?
or as other towns around, how much they pay and what they charge and see if there's how
We can
everybody,
budget comparisons.
because there's some small towns around that do have ambulances and some that don't.
Yeah, there's some available information.
Good for discussion. Thank you.
Thank you for coming in.
Thank you for having us.
We got a quick question in the audience.
Oh, Dave, sorry.
Just a quick question, I guess it's for these guys through the board. They're saying if the town does not pay this fee that's been established, they're gonna stop coming. So I guess my question is, have they stopped going to Waterville if it's all? Because they clearly do not pay.
Right, well, we have a mutual aid agreement.
So you still go there, so no fees.
It's, they would support us if we had to call them to go to one of our towns.
So you guys still go there with fees,
As a mutual aid,
As a mutual.
not as a primary service.
regardless, you go there without getting paid for that.
What's your football volume over there?
Yep. Thank you. That's fine.
Currently, or what we did have?
Current.
Well, today was different than most days. I have to go over the numbers.
Today was different than.
Today, I think we responded for the city water bill maybe 3 or 4 times. I don't know if that's an average number. or not. It fluctuates a lot. I could,
It's definitely not every day.
yeah, I could get back to somebody with a better number over the last month or two.
So to follow up that question, your trucks were busy. Water will have to respond in your place to Oakland. Is that mutual aid as well, or will they receive a bill from water?
I'm understanding.
Mutual aid for you. So, I mean, it would work under your.
I can't answer for water, but it's really not. but mutual aid agreement.
We'd certainly have to have that hammered out, so we understood that, because that would be a shocker to get a bill from the city of Waterville.
I don't know if I can get that answer for you, but I'll try.
Thank you. So moving on, next one, fire department, the PPE grant. Thank you, gentlemen.
Thank you.
Got two copies here. To present that, you also have a flyer that I handed out to you. That's right there.
Just give them a minute to get out so everybody can hear what we're talking about. So about a month ago, I came in with the assistance firefighter grant that Oakland had received, and the council approved the matching funds for that project. Since then, we've gone out to bid, we put our packages together, we received our bids back, we did an opening last week. And as we're going through them, the cost of items have increased significantly since we got our estimates to put the grant together, which is taken about a year from, it was this time last year when we were getting our estimates to, now we're looking to finally spend the money. So I put together the top sheet. I think you have there is a summary. You'll see I put down what the federal funds are, how much we've already approved, the project cost. Below that is a summary of the bids that we received. We received bids from 4 different vendors for various pieces of equipment. Some of them didn't bid on all of it. Some of them bid on some of it. So between myself, Tony, and Antonio, we worked on pulling out what's best, what we feel is best for the town, whether it's, some of it's low bid, some of it's not. Some of it's based on the quality of the gear which we want to receive. Some of it's based on delivery time, where we can get stuff in a month or two versus 8 to 10 months or more. So we put together what we think is the best package, pulling in our bid process. We said, you know, one of the stipulations in there was that we would be able to pick and choose what we wanted. So we didn't have to buy all the items from one vendor. We could buy helmets here, we could buy gloves over here, so we can kind of pick and choose from their list. So when we did that, we came up with a number of $58,114.65. So that put us $8,597.65 over budget, if you will. So that's that difference number you'll see down towards the bottom of the page. So talking with Ella, I had a proposal on how we could get what we wanted. That we, you know, get the materials that we feel are the best. We are currently owed $67.55 from MEMA for COVID-related expenses, in which a lot of those expenses were accrued in the previous budget cycle. So we're not repaying back anything from this cycle. So I included the letter. That's the third page down at the bottom. It gives you that number of work completed total. That's the amount that we are expecting. We followed up with MEMA this week. They said we should be seeing that money in the next couple of weeks deposited into our account. So I propose that go to general fund and not to my operating budget. And then I'm asking for an additional $1,842.65 on top of this, that $67.55 from fund equity, because this has to be new money into our budget. We can't use our operating budget to match these federal grants. So that's how I'm proposing to pay for that increase in costs. So ultimately, once that $67.55 is deposited into, Kelly does her thing and deposits that into fund equity, we'd be asking to pull a total of $8,597.65 out. Clear as mud.
I'd make a motion, we use the $67.55 of the MEMA money and the $18.42 of additional funds to buy this equipment.
Can I change that real quick? Can you make a motion to take the $85.97.65 out of fund equity?
Sure.
What we're going to do is we're going to reimburse fund equity with $67.55.
Yeah. So move.
Awesome. Motion made. Do we have a second? Second by Dave. All question, Trigon?
Yes, Tom.
Had we not done this, which makes sense, you guys have done your homework, what would that $67.55 had gone to? Had we not put it either?
Well, we didn't have it earmarked for anything. Probably we would have bought turnout gear that we need to replace, that we haven't been able, that is overcycled, but increasing cost. We would have used it to handle increasing cost and purchasing turnout gear for firefighters. So we're basically using it for the same thing. We're just getting a bigger bang for our buck.
And how is the bid process, not the bid process, are these companies all giving us the information that all those bids are going to be good even 2 months from now or whenever we actually?
We have 15 days to secure, to tell them, yeah, this, I mean, it used to be at 30, 45 days. Basically, we have 15 days to lock in the price. Once we lock in the price, lock in the price. That's why we opened bids last, I think the last week, maybe last Wednesday or Thursday. Jan came up and we opened the packages, ordered everything. And it's like, okay, we gotta turn this around quick because council meets and then we're off.
We've gotten an extra pickup truck thrown in there somehow. But is that the right actual bid price? Different subject.
So motion was made. Second by David. All in favor?
Thank you very much.
The next item on the is I'm going to step off and excuse myself from it because I have a direct family member involved. They,
Okay, we have 3 different companies here, and Kelly's gonna run us through it. What's gonna cost us?
Yes, we had three
So
companies.
Let's just share what this is, so that we get it out to the public.
Okay, so I put together this chart with all 3 companies, what the monthly recurring charge will tax.
What are we buying? What are we looking to buy?
We went out to bid on our phone system for the town. Our current phone system was from 1998, I believe. You no longer get the phones, some aren't working, some are working, lights don't work. There's lots of crackling, so we're looking to go to an internet-based phone. So we went out to bid, we opened them up. We had 3 companies respond: Spectrum, Main Tech Group, they're also our IT people, the technology group, and then Main Communications Consulting, which is the gentleman who operates our phones now. His name is Dave Hewitts, he runs that company. So I kind of pulled out from the bids the most important information. So the monthly recurring charge with taxes included is that first line. With the internet phones, Main Tech Group and Main Communications Consulting said we would need to upgrade our internet. So currently, we pay $89.99 a month, and they said we would have to upgrade that to the internet gig, to be able to handle the volume, which would be $164.99 a month, which would add an additional $450 to that monthly recurring charge, because there's 6 locations. So you would take that 75 times the 6 locations, so they'd all be able to handle that volume. So Spectrum is on a private internet line, so we wouldn't have to upgrade our internet because it would be separate. It would be private, there would be no interaction between the 2 internets. One would be for voice only, and one would be for Wi-Fi and surfing the web. Spectrum has a 60-month term locked in at that price. After 60 months, the price drops $200 a month. Main Tech Group did a 36-month contract, and Main Communications Consulting didn't put a limit on it. I mean, we've been using him for 30 years now, 25 years. So as long as we use him, he's not going to put a limit on it. Support and training is all included in all 3 bids. Upfront costs, which won't be reoccurring monthly. Spectrum is 0. Everything's included in the price. Main Tech Group was $7,664. So pretty much buying the phones up front, cables, switches, whatever is needed. And then Main Communication Consulting was $4,491. Like the next line, cables and switches were included. Spectrum, yes, the other 2, no. They did provide good references. The phone types, they're kind of all the same. Voice over internet phone. We would get free replacement with all 3. So if something were to happen to the phone, broke, dropped it, stopped working, they would just come and replace it for free. And then the increased internet speed needed. We wouldn't need it with Spectrum, and we would. And then that last line is what the monthly fee would be. So as you can see, pretty close between Spectrum and Main Communications Consulting. So
With the difference being that we don't have to pay for the equipment with Spectrum.
we wouldn't have to front out $4,400.
if the council wishes to move forward with this, we are certainly, at this point in time, based on what you're looking at, would recommend Spectrum Communications. And I think what Kelly said, as far as them having a dedicated line, they will come in and put a dedicated line in every department that we have. So you're not sharing your internet with your phone, which is a weak point.
And if we do build a new building, it all goes with us.
Billy, just a question, if they're looking, if our internet isn't powerful enough to supply the phones, should we be looking, is that a separate category that we should look to increase our internet capabilities within our own community? Within our own organizations? That they
We're all
wouldn't even be there.
hardwired in anyway, like the internet. Yeah, I don't know.
So we have different levels of service, Dave.
Yeah.
And so in order for our internet in our departments to be able to handle both the phone service and the internet service, we'd have to bump up to the next speed, which is why we're looking at a $450 a month increase for both these two companies that are providing it.
The
So
six
we will be
locations
bumping up.
would have-
Yeah, that's why I was looking at, is it more cost effective to just increase our internet on its own, rather than paying the fee here? Not being tech savvy, so.
I'm not seeing an issue with internet speed as it is. I mean, everything.
It just won't support the phones.
It just won't support the phones, whereas Spectrum will be doing that, basically, but they are gonna increase our
But it's on-
internet speed, but they're gonna have
it's
a
on.
dedicated line for the phones, so it won't be needed.
Roughly, what do we pay now per month for our?
About $930.
930. So we are gonna be wrong.
But it's, I mean, we'd be able to absorb this $200, increase for the next 6 months, but then we would be able to budget for 5 years. We're gonna know what that price is,
And then after the 5 years, it goes back to pretty much what?
what we're paying now.
But the phone system would be the exact same throughout. All I have to do is at a fire station, pick up, hit L's button, boom, we're ready for our office.
And the nice thing about this is you can have one number for the entire town. You can call 7357, hit 1 for the town office, 2 for the police department, 3 for the fire department, and just do the phone tree if you didn't want to have separate numbers. So it would take us into the next. I'm not a fan of phones, and this complicated stuff is not my thing, but the bottom line is our phones are breaking. And we've got issues. Kelly can't use her phone a lot of times, so it's just the system that they have to create that needs to be upgraded. Public Works Garage, they don't, have they got any phones that work down there now? I mean, so we've taken all the life out of this stuff. We're at a point where we have to go and consider making a change.
I assume the negative of the whole idea is gonna be press 1 for the town office, and then when you get to town office, press 1 for the town manager, press 2 for
I
this,
hate
press
that.
3 for
I
this.
agree.
No, I
And by the
get
time-
what.
if you want these repeated, press 9.
Yeah.
And that's the way of the world, and it drives me crazy. but-
And we
Drives a lot
don't
of
have to go that way either, Don. We can have police department's number 2202, get a fire department's number, and just keep it that way as well. But that's an option if you choose to do that.
And I think you said that the main number, which you just said, I don't remember what it is, but all the ladies in the front office would be able to answer that.
Correct.
So any one of them, they all gonna get that call.
They can program certain phones to ring at certain,
So if any of those 5 are at their desks, they're gonna be able to answer that.
I think it'll stay business as usual. We're open, we answer the phone. We're not open, we're closed, whatever. They can press 1 to leave a message for the town manager. We can put that auto attendant in place when we're closed.
Anything else? What we want to do?
Say go Spectrum.
Second.
We have a motion and a second to go with Spectrum. More discussion? All those in favor?
Thank you.
Oh, yeah, everything?
I think that kind of, we do have my contract floating around down there. You could get my signature on it. Want to discuss it? We can discuss it.
Executive session.
We don't
We
need
have to
to.
go to an executive session.
We don't need to. Do. I don't have it. We'll have to do it.
We want to go to executive session.
I'd like to.
I'll make a motion. We want to-
No, we
can't.
can't.
I don't have it. I don't have it listed.
It's scheduled for the next meeting.
It's gotta, I
It's
gotta
gotta be
legally have
scheduled.
it done 24 hours before the meeting.
Okay.
The next meeting date,
It's gonna be the 14th.
David, did you have anything?
I am good, sir.
Mr. Nutter?
I do not.
Something that I don't know all the details about, but it's on the dams committee. Major repair work needed for the village dam in Belgrade. I plus that. Plus $1,000. So all gotta be done at once. So our share will be significant, but we're only 17% of the total budget, so we'll get a small share of it, but it's a lot more than.
So if it's $100,000, our share will be 17. Is that what you said?
Roughly, you know, the 100,000's not exactly accurate. They gotta do a ton of concrete work, reinforcement work. They showed pictures. I'm gonna try to get a packet to show you what it actually looks like. We haven't got that, but
Ella sent us the pictures.
Yeah, we actually got the bill from Quebec Dams, and this year it's gonna be 20,000 and some change. Just got it. for the-
Did I see that we're gonna do that work, proposed to do the work in the summer, this coming summer?
Think this-
So we can put that in the budget? We don't need to send them a check this week.
Right, it's gonna be something that's gonna be budgeted. I think it was 7,500 last year, now it's gonna be 20,000 and some change this year.
Sure.
Another big increase.
There's some serious concrete problems there. That dam has a lot of age on it.
Is that all you had, Doug?
yeah, I just wanted to update. and bring it up.
Did they make any estimate of removing the whole thing and replacing it like the dam at the end of the lake down here? CMP replaced that a few years back now, 25 maybe. They tore the whole dam out and replaced it because it was getting in serious shape.
I haven't heard, I know that in the past, the replacement of the dam was so prohibitive that I didn't think people would buy it.
I don't think we would either, but
But I can ask that
spraying
question.
concrete in there only as a stopgap.
It's, you know, it's amazing what they can do. But you're right, it was better.
Okay. Kelly, did you have anything tonight? John? Going forward, I want to make sure that we just, been attending a few of the meetings. I just want to make sure that from here forward, if anybody from the audience at any time wishes to take and have brought something forward, I'd like you to please bring it forward and give it to Elle before, so we have record of it and it's brought forward. So for the next meeting on the 14th, at the end of the meeting, like I've done for years and years and years, I'll go to David, I'll go to here, and then the audience, I'll thank you for coming in. And unless you have brought something forward to Elle. Thank you. David?
I make a motion to adjourn.
Second. All in favor? Thank you and good night. Hi, John. Did those tires get taken care of?